Hello and good morning, everybody. Thank you so much for hopping on today's MarketEdge webinar. I'm Anna Patrick. I am the Director of Strategic Partnerships here at CSG. Many of you, as I'm kind of going through my attendee list here, have signed in. I recognize a lot of your names that have been on other trainings that we have done, whether that's been with carrier e-apps or on Medicare Center or Lead Center. So I welcome all of you to today's training. Today's webinar is by far my favorite webinar to do. This is one tool that when I go out and I present to agents in person at different agent conferences, this is the tool that I spend the most time on. This is the one that I present to agents, and I'm always blown away after the presentation about how many people come up to me afterwards and they say, I didn't know CSG did that. I've always used CSG to run quotes or to run my med sub quotes, to do some ancillary quoting, but I didn't know that you had all of this data in your tool. And a lot of people, when they sign into CSG and they see in their tool section MarketEdge, they don't know what MarketEdge is, so they never click on it. So this is always one of my favorite webinars to do with agents, and I always get that feedback afterwards is, I wish I knew this information earlier. I spend a lot of time with agents, not only presenting them the information and how to obtain it, but then now that I have this information, how can I utilize it to full potential? So, okay, now that I understand how many enrollments are with certain carriers, what can I do with that information? Now that I know how many people are turning 65 in this zip code, how do I then get a hold of those people? How do I use my marketing dollars to better market to those individuals? So there's a lot of information that you can obtain from our tools, but we always have to go the next step. Now that I have this, what do I do with it? How can this help me? So hopefully in today's presentation, you will get a lot of that value. I will go through step by step on how to run the reports, but keep in mind, you can have all of this data at your fingertips, but it's taking it to the next level. What do I now do with this information? So keep that in mind as we're going through here, and start thinking about different ways in which you can utilize it. I love hearing how agents are utilizing the data to drive their sales, to help them with their marketing pieces. So please always share your success with me. I love hearing that. So a couple of housekeeping things to go through before we get started is, one, we are recording today's webinar. You will all receive a copy of today's training following the presentation from the GoToWebinar system. We also have our Q&A live, so if you want to ask questions, feel free to do that. I will be glancing over at the questions as I present, trying to answer questions as they come in, but I am going to answer a majority of everyone's questions at the end of the webinar. So if you want to hold your questions towards the end, in most cases I do answer your questions during the presentation. So I've done this presentation so many times, I already kind of can sense what agents are going to ask. So that is a blessing there. So because we have so many agents registered for today's training, I just want to get a good idea of who you all are, your comfort level with CSG. So just curious to know here, have you used CSG to quote before? So CSG, we're one of the first companies in this space to allow agents to quote Medicare products. So we actually started as an actuarial consulting firm, and from there, because we obtain all of the rate data, we had a lot of agents and top carriers and top FMOs in the industry come to us and say it'd be great to be able to quote all of our carriers on one platform. So because we were a consulting firm, an actuarial consulting firm, we had all that rate data. So then we developed a software, and we're the first med sup quoting tool in the industry to quote carriers. So within our quoting tool, we quote Medicare supplements, Medicare Advantage, Part D, prescription drug plans, SNP plans, and then we also quote ancillary products, our hospital indemnity, our dental, and our final expense. So from the quoting tools, we have expanded into e-apps, market data, rate adjustment history, carrier enrollment, a lot of that which we're going to be covering here today. So I always tell agents CSG is more than just a quoting tool. So 61% of you are saying yes. I'm happy to see that. 40% of you are saying no. I guarantee you 40% of individuals that have never used CSG before, you are going to sign in. You're going to start using it not only to quote, but being able to get this enrollment data. I've had a lot of agents say, I wish I would have started using CSG when I first started in this industry. It does make everything so much simplify your entire sales and quoting process there. So thanks for those answers. And then we are going to be covering a lot of different topics today as it pertains to MarketEdge. So I'm just curious to know if there is a topic that you are most interested in today. So what the MarketEdge and CSG tool can do for you is it can break down Medicare demographics by state. So we can see by state and by zip code how many people are over age 65, turning age 65, on a Med Sup plan versus a Medicare Advantage plan. We can also break down the enrollments by carrier, especially on the Medicare Advantage side. We get that information monthly, so we know how many people are enrolled within these certain Medicare Advantage plans. And then within MarketEdge, we can create carrier heat maps. And carrier heat maps allow us to see where a carrier is competitive at nationwide without having to run several different quotes. So these are the kind of the three pieces that I'm going to spend all of today's webinar going through. Curious to know which ones you are most interested in. If it's all the above, it's all the above, and we will cover absolutely everything in here. 80% of you are saying all the above. I love that. Also keep in mind that I could spend hours and hours on CSG, especially those that are new to CSG. We do offer a new to CSG training, which I highly recommend. We cover everything within that training about quoting and enrollments and scopes and market data. So if you are new to CSG, I definitely recommend trying to attend one of those new to CSG trainings. We record all of them, so I can always send you a previous webinar that you can quickly watch or re-listen. All right, so let's go ahead and get started here today. I do have just our website here pulled up, csgactuarial.com. Keep in mind, if you have any questions or technical support, need that technical support, our phone number and our email is listed out on our website, so you can always call us or send us an email. But what I'm going to be covering here today is really how our data can give you that competitive advantage, giving you the real-time data so you can make better informed decisions on your marketing. We're going to be going over all of the quoting activity and Medicare demographics so we can really drill down by state and by zip code that enrollment data. And then I'm going to show you how you can create your own carrier heat maps. So this is kind of all detailed out in our website. So if you ever want to go and watch some breakout tutorial videos, we do have those out here if you ever need to come back to them later on. So for those of you that are accessing CSG through Medicare Center, it's really easy to get to our platform. So I am signed into Medicare Center right now. When you are signed into Medicare Center, all you have to do is go to your name in the upper right-hand corner and click on CSG app. So all of you have access to CSG. There is no charge to use CSG. This is free through your Integrity FMO or upline. So thank them, thank Integrity for providing you these resources. Again, all you have to do is click on that CSG app. What will happen is it will say loading, loading, loading in the upper left-hand corner, and it will open up a new tab in your browser that says welcome back with your name, and then it will say Medicare Center and then the available tools for you. So if you are using CSG through Medicare Center, maybe you are using CSG through your Integrity FMO's branded quoting tools, that is totally fine. All the same great technology is available to you on their platforms as they are inside Medicare Center. Or if you have an individual subscription with us, your quoting tool may look like this. It may just say CSG Actuarial on it. So they're all the same tools, same technology, just branded, and the colors would be different. So we're going to go through MarketEdge first. MarketEdge is where we're going to be spending a lot of our time here today. I will use the MedSup quoting and the Medicare Advantage quoting to break out the enrollment data for you by carrier. So we'll be taking a look at that. Again, for those of you that are new to CSG, when you sign in, here are all of the tools that you're going to be able to see. Being able to run your MedSup quotes, your Medicare Advantage, your hospital indemnity, your final expense, and your dental. So we do offer you a variety of different products to quote, and we do quote 100% of the market. So you will see all companies when you run a MedSup quote or a Medicare Advantage quote. So let's go ahead and click Run Search underneath MarketEdge. If you're one of those agents that want to follow along with me in today's training, feel free to open up your browsers and start kind of walking through this with me. We always get feedback from agents that I just need to spend a little bit more time running through it. I totally understand. I am one of those learners that I have to walk through the steps of something in order to understand how it's being used. So if you need to pull up your own tools on your system, feel free. Or if you just want to kind of listen and follow along, that is fine by me. So when you first sign into MarketEdge, MarketEdge does three things. One is it summarizes the Medicare demographics by state and by zip code. It also summarizes quoting activity. So we can see out of the 8 million quotes that are ran on our system each year by insurance agents nationwide, what plans are they quoting? What ages? Is there a gender that's being quoted more? We can break down all that quoting activity. Now, I'm not going to spend a lot of time today going through that component of it, just because I know that most insurance agents don't really care about that as much as the carriers care about it. The carriers want to know what you're quoting so they can make sure that they're providing competitive pricing for the plans that you are quoting, especially in the areas that you are quoting. So I won't be going over too much of that, but just keep in mind that's a component of MarketEdge. And then the third is our carrier heat maps, and you will use those carrier heat maps in our go-to rate comparison here at the top. So when you first sign into MarketEdge, the first thing you will do is select your state or your state. So we can select all. This will pull up a national map. I'm going to pull up a national map. It may take a little bit longer to load, but I do know that we have agents that are signed in multiple different states. So I do want to make sure that I kind of give you all a good picture of the entire US. But you can just come in here and select your individual states. If you wanted just to see a particular zip code, you can enter in that 3 or that 5-digit zip code. Now your quote parameters, this would be if you were interested in knowing the quoting activity. So the most quoted plan type in our system is a 65-year-old Plan G female non-tobacco. That's what all of the data tells us. But what's really unique and interesting with this, and this is something that I track monthly about agent quoting activity, because as a trainer for agents, it's important for me to know what you're also quoting too. So what's really unique is that we can see just from a time shift, you can see how we can adjust the quote date range, how we're seeing this shift in what's being quoted for G and what's being quoted for N. And in the last year or so, that plan N has spiked, not as much as the G. The G is most quoted, but we are still seeing that N really come into play. And what's really interesting too is that we still see a ton of Plan F activity in our system, especially for those older ages. So people that already have a Plan F that can move to a different Plan F as long as they can pass underwriting. We're seeing a lot of that quoting activity pretty dominant in the tool. But I'm just going to show you just how many Plan G quotes are ran. Again, if you wanted to come in here and drill it down, you absolutely could. Keep in mind, this just takes a picture of what agents on CSG are quoting. We are the most used MedSup quoting tool in the entire industry. Medicare Advantage quoting activity won't be as high as MedSup in our system because a lot of agents are using Medicare Center for their Medicare Advantage, or they're going to Medicare.gov to do their Medicare Advantage. But MedSup, we're pretty dominant. A lot of carriers will use our data for their own strategy for sales. So important to know. And then you can always adjust the quote date range. So I'm going to use my quote history. And then you can view this differently. You can view it on a map, a chart, or a table. Map is my favorite view, and the reason being is because the map view is interactive, especially if you're doing an entire US map. You can hover over into different states. The chart and the table, you're only able to break it out in one particular state, but it is really cool if you want to create different type of charts on especially quoting activity. Those are great for. But I'm going to really be demoing the map version. I think it's the best user-friendly version also to use. So it's going to go ahead and load here for me. As I mentioned, it may take a minute or so to load because I did pull in the entire US and it's pulling in a lot of data in the back end. So give this a second. But once it starts loading for me, it's going to show you basically a heat map. So areas with the most quoting activity is where it's going to start, but we can then adjust that. So we can heat map it by areas that have the most people turning 65, or the most people over age 65, or the most people that are on a MedSup plan or a Medicare Advantage plan. So we're going to be able to filter it over here on the left-hand side once everything loads into the system. And then once it's loaded, we can go into a particular state. And as we look at a particular state, we can zoom into a 3-digit and also a 5-digit zip code. So I'm going to give this again another second or so to load into the system. If it ends up going too slow, I might just drill it down to one particular state. But as this is loading, curious to know where you guys are all located, because I can drill into certain states just to show you what your states look like. You can see it's popping up. So in the questions, go ahead, type in your state. I will cover your state demographics for you if you type your state into the questions. All right, we have some Indiana, we have some Iowa, Florida, Michigan, Nebraska, Missouri, Alabama, South Dakota, Oregon. We have everyone. I have a New Hampshire agent. Hi, Mark. So this is great, and I love this too because it's just incredible how we can all connect with each other here on this webinar. We have agents everywhere. I love this. So as I mentioned here, we have our heat map. So this is the entire U.S. Right now, it's filtering out by MedSup quotes. So just within our system, in the last 30 days, Plan G quotes, we can see how much quotes are being ran. So we see the most quoting activity for a Plan G age 65 in Texas, Missouri, followed by Florida, California, Illinois, and Pennsylvania. I did see we have a lot of California agents, Texas. I did see some Missouri on here too. So this again gives you a good indication on the quoting activity where we're seeing the most quotes ran at. So in order to filter this out, so instead of looking at quoting activity, let's say we want to look at population turning 65 or population over age 65, or maybe we want to know the most states with the most Medicare Advantage enrollments. Now keep in mind, a lot of this is going to be based upon demographics, right? Especially for population, overall states. We know that, again, California, Florida, Texas, those are our biggest states. Those are the most populated areas. So as I hover over a certain state, I'll use California here as an example. I'm going to exit out of this just to kind of show you how this all works. So as I hover over California, we're going to be able to see quotes, and keep in mind I only did MedSup, that's why Medicare Advantage is pulling in at 0. But I can see there are 6.2 million individuals in California that are over age 65. There are 35,000 plus that are turning 65. So this is individuals that are turning 65 this month. We update the data monthly. We do have different information from CMS and census information that we can populate these numbers. We update them monthly. A lot of agents will say, well, it's great to know T65 this month, but what's it going to be in 3 months, 5 months? That's when we really start trying to market to those individuals. And what I tell agents is, looking at the data every single month, we don't have a huge spike in births in a certain month. So this data is going to be relatively the same month to month. Now, over time, in the next 8 months, the next year to 2 years, that may look different, just how people are, some of those baby boomers, and so keep that in mind. Over the course of time, it will change, but relatively month to month, those numbers stay the same. And then we can see how many people are in a Med Sup versus a Medicare Advantage. Now, this is the most interesting piece. And what's really interesting is if you started tracking this 2 years ago, what we saw with that shift, how there's more Medicare Advantage than Medicare Supplement. And if you need the data to support that theory, our data will do that for you. So you can go back if you've previously ran them in the past, and then start tracking it moving forward. So once you hover over a particular state, you can then zoom in even further. So as I zoom in further to California, it now breaks California up into 3-digit zip codes. So again, now I can hover over each 3-digit zip code and see, okay, in this zip code, how many people are over age 65? How many people are turning 65? How many people are in a Med Sup plan versus a Medicare Advantage plan? From that 3-digit, we can zoom in even further into a 5-digit. So now I'm going to zoom in even further, and I'm going to be able to see this area broken out for me by 5-digit zip code. When I pull in 5-digit zip code, it's also going to bring in that median household income as well. So I know in this 5-digit zip code, how many people are over age 65, how many people are turning age 65 this month, and then Med Sup versus Medicare Advantage, okay? So we can take it state, 3-digit, 5-digit zip code levels, okay? Now, if you are an agent that loves the data, and you want to export all the information into a raw Excel file instead of using the map, there is an export option over here on the left-hand side to export, okay? So I'm gonna just hover over a couple of different states here based upon the agents that I kind of saw in here. So Bernadette, I'm gonna start with you. You were the first one to respond, quick on your toes there. This is what Indiana looks like. So what's really interesting too is that every state may be a little bit different, where we see Indiana as pretty and even half, less than half being on that Med Sup, whereas we saw California was a lot different. There are some states, like if I go over to Illinois, where we're a little bit closer on the Med Sup to Medicare Advantage. So keep that in mind. Every state is going to be different. And when you zoom in, like let's say I zoom into Indiana here, the numbers are going to be different. So you may find some pockets that are more Med Sup than Medicare Advantage. It's rare, just kind of what we're seeing in today's industry, but you will see some that are more evenly split between Med Sup and Medicare Advantage. Again, you can zoom in even further into a particular area where you may be able to find those pockets where there's more Med Sup versus a Medicare Advantage, or that even split like you can see in this particular area. And just how it's just dramatically different, again, based upon region. So I do recommend you coming in here, finding your state. Let's kind of go over. I had another, Sherry, you said Iowa. That is my neighbor state. I'm in Omaha, Nebraska, in case anyone cared, go Big Red. Going into Iowa here, again, this is a state where we have more Med Sup than Medicare Advantage. This is just kind of the demographics, more of the Midwest versus what we see on the coast. So we can zoom in even further to Iowa. Again, see the pockets where we have the most people that are turning 65. Again, here, kind of just in our Council Bluffs area, if you're familiar with Iowa, we have more Med Sup over here. You look at the Des Moines area, a little bit more Medicare Advantage, but more of an even split. So a lot of this data we'll kind of get into Florida too. I have Angel, you're in Florida. I saw a couple of other agents on here. difference in Florida too. You can look at Florida here, a lot more Medicare Advantage, but look at that population turning 65, a really big Medicare state overall. We see a lot of activity in Florida. Again, you can come in here into your own states. Let's look at Alabama. That's another state. Wanda, you're in Alabama, so we can look over at what Alabama looks like as well. Way more Medicare Advantage, and especially than what we saw in Iowa as far as the MAPE goes. So how can we use this data, right? This is good information, right? But how do we now apply that? So there are a couple of different scenarios that I'm going to give you. One is that I know that most of you are licensed in multiple states. Most of you have figured out how you can expand your book of business into other states, especially with all the different video conferencing that can go on, all the purchasing leads now that we all have access to. You know what? You may not live in that particular state. You may not know the demographics. You may not know the pockets in which you should be doing advertisements in, you should be doing mailers in. So this information can then give you the resources to, when you are advertising, when you are using Integrity's Lead Center to purchase leads, you know exactly what areas you should go in and be purchasing leads at. You know exactly what areas you should be selecting on your Facebook marketing campaigns to market yourself to. You'll know exactly what areas to go to those direct mail vendors and say, hey, I want to do a direct mail drip campaign in these zip codes, because that's where I know I have the most people that are turning 65. Or maybe you are an agent and you, although I know a lot of you do MedSup and Medicare Advantage, but if you are more dominant in one product line, maybe you are heavy MedSup, you want to make sure that you're marketing in areas where there is a high MedSup population and not a high Medicare Advantage, right? So using the data when you are going and purchasing leads or doing any of your advertisements, that you're advertising in areas that make sense for you. When we create our carrier heat maps here in a little bit, we're going to know now what carriers are competitive, what's my opportunity. So if I want to sell more ACE or more LIPS or more Medico, I know that I should be doing a Medico marketing piece in this area, because how many people are turning 65 and that Medico is really competitive in this spot. So we're going to start putting all of the data together here in a little bit. So now you know what carriers you should be promoting there, or you have a good opportunity because they have the lowest premium. So that's how you can utilize it. I know a lot of agents, and I'm going to start hovering over some different states here. I have Leslie, you're in South Dakota. Let me just hover over South Dakota as I'm kind of talking through some more examples here. With this information too, what you can really do, I don't know what's highlighting it there. Let me get out of this highlight. What you can do is, let's say you are starting to get involved in different community events. Where you are hosting those community events, where you are hosting your Medicare 101 seminars, you want to make sure that you're doing it in an area that makes sense for you. This is really bothering me that it's highlighted like that. Okay, for some reason I can't get rid of that. So I tell agents where you are holding those events is key for you. So if you are holding a Medicare 101 seminar in an area that doesn't have a high population turning 65, you need to look for certain zip codes that have those individuals, because where you're holding those seminars at, those seniors are likely, or those people that are turning 65 Medicare eligible, they only have a certain distance that they're going to be willing to travel to, whether that's 5 minutes, 10 minutes, probably nothing over than 10 minutes. So you don't want to host an event clear across town where there's not a lot of individuals that are turning 65 in that area, because they're not going to drive to your event. So where you should be holding those seminars is key too, and using that data to figure that out. I have an agent here in Oregon, so I'm going to hover over Oregon here. I have a cousin of mine is in Eugene, Oregon, just graduating from law school. It's interesting, a lot of these states too, being able to travel and visit all of you guys too has been really fun. I was just out in Salt Lake City last weekend visiting with a lot of agents there. So it's always great to see a lot of you on the road as well. All right, let's kind of shift gears here. I'm gonna just look to see if I have any questions. I'm gonna repeat this information really quick. So as you cover over a state, I have, let's see here, Michael, you wanna see Arizona? Happy to show you Arizona. That's our second home is Arizona. We love Arizona so much. As you hover over that particular state, we can then zoom in. So you hover over your state, you hit zoom in. Once you zoom in, it takes you to a 3-digit zip code. And then as soon as you find your 3-digit zip code and you want to zoom into a 5-digit zip code, you can hit zoom in, and then it drills you into that 5-digit zip code, okay? And then if you need to go back, you can just hit the back to AZ button here, and then back to national. So that's how you do that. All right, let's go ahead and shift gears over to the carrier heat maps. So carrier heat maps are also a fun piece. So I'm going to go back to hit new in MarketEdge. So if you are signed in to CSG, still click on MarketEdge as far as your tool. And then we'll want to go to our go-to rate comparison. So I gotta be a little bit more patient here. It's loading here for me. Okay, so when you sign into MarketEdge to do your carrier heat maps, you're gonna click on this go-to rate comparison here. I'm gonna repeat that one more time because this is the question I always get follow-ups. How do I go to those carrier heat maps? Still go into MarketEdge, but then click on this go-to rate comparison here. And these carrier heat maps, these are just for Medicare supplements. So what these heat maps allow us to do is see where a carrier is competitive at nationwide without having to go and run all these different quotes. So you may start hearing about a lot of new med supp carriers coming into the market. So we have at Integrity, we have partnered with some incredible med supp companies to really offer all of our Integrity agents very competitive plans that are really geared towards your clients and making them attractive to them with different household discounts. Some of these companies have A+ ratings, really low rate adjustment history. So we have partnered with some great ones. We've partnered with ACE, Aflac, Allstate, Ellipse, Lumico, Medico, Humana Achieve is one. Humana Achieve just came out with some new states. So a lot of you may be seeing communication from your uplines about these different companies. So as these companies come out with rates, or they may take a rate adjustment and you want to know where they're competitive at, you can run a heat map instead of having to go and run every single quote. That would take you literally days to do, days to be able to figure out where this carrier is competitive at compared to the other companies that you do business with. So within 30 seconds, you can just create a nice heat map to see where these carriers are competitive at. So I'm going to run through a couple of examples here. Keep in mind, you can run your own, you can run unlimited maps. I love this. And you know what? A lot of carriers use this to then market to all of you on where they're competitive at too. I've seen a lot of different carriers' emails and I'm like, oh, that's a CSG heat map. So first and foremost, you would come in here and you would select your states. If you want to do national, you can select all for national, and then you can do a compare type. I recommend 3-digit zip. Most carriers do price by 3-digit zip. So if you do a state, you'll notice when I run a particular carrier, they may be competitive in certain pockets of a state. So like Medico is very popular in more of your suburban areas than rural. So you'll be able to see that if you do a state, it would take an average. So it's not going to be a good picture. So I do recommend a 3 or even a 5-digit zip, depending if that carrier prices by a 5, but most price by 3. And then you would choose your effective date. So if you want to see, if let's say a carrier is coming out with a rate increase June 1, and you want to know how that rate increase is affecting their competitive landscape, you can come in here and move that effective date forward. We already have those 6/1 rates loaded into the tool. And then you can say, I want to see competitiveness for a plan G. You will want to select each particular plan parameters. So if you select multiple, it will take an average and it won't give you the best indication. So just make sure that you select one plan, one age, one gender. So I'm going to do a 65-year-old G non-tobacco female. If you want to include household discount rates within that search, you can apply those or not apply those. If you want to include the demographics that we saw on the previous screen, I recommend including them, because now that we know a carrier is competitive at age 65 in a zip code, we want to know, well, how many people are turning 65 there? So I can go market ACE, or I can go market Allstate, or I'm going to have really good luck showing this low premium in this zip code. So it is cool to also include the demographics. That way you're not going back between different maps. If you want to include select plans, you could. There's only a couple of carriers out there like United Healthcare that offer select plans, but that could end up skewing the data. So I'm just going to leave those out for now. And then your companies. So this is where you're going to select that company that you want to look at their competitive landscape. So in this case, I'm going to do a couple of different maps just to kind of show you guys here. I'm going to use ACE as a starting point. So I can come in here and I can select ACE. Now, if it is a company that has multiple subsidiaries or multiple charters, you can select multiple. So one good example is the Lumico and Ellipse product. They are Ellipse, I'm going to type in Lumico. They are Lumico in some states, and then they're Ellipse in others. You would want to select both of that. That way it pushes out both plans. Or another good example on here is Aetna. Aetna has multiple subsidiaries. So they may have like Continental, Aetna Health and Life, Ascendo, American Continental. So you may want to select all of the Aetna ones if you're doing a national map. Okay, so you can select, just don't select two different carriers. So if you select ACE and you select Lumico, you won't know which is the most competitive. Okay, so make sure that you're only selecting one. Make sure I just have ACE there. So then you want to say, I want to compare ACE to what carrier? So this is where you would come in and you would select the companies that you do business with. I know that you guys don't do business with all companies. That's really overwhelming, but we can select all companies here. That way we can see just overall on the entire market, where does this carrier stand? So you can either come in here and just select the companies that you do business with, or you can say you want to compare this carrier to all carriers in the market, okay? And then from there, our comparison values 5 to 10 is default. As I hit generate here, I'm going to explain to you what that means. So when this creates a map, areas of green is where it's going to be the lowest premium. That means ACE is the most competitive carrier out there compared to everybody in the market for a female 65-year-old non-tobacco plan G. Areas of yellow is where ACE is within $5 of being the lowest rate. Orange is where ACE is within $5 to $10 of being the lowest rate. And then red is where ACE is $10 or greater from being the lowest rate. So if you wanted to adjust the 5 and the 10, you can do that. What happens a lot of times with some of these carriers is that they may be within $5 of that lowest rate. Some of them may be under $1, maybe it's 30 cents, maybe it's $1, maybe it's $2, and you want to change that for the values of being like 2 and 5. That way you know, okay, $5 versus $2 can be a difference. So you can always adjust those. I'm going to show you here on this map, even areas of yellow, they're still going to be really competitive because they're still within 30 cents. And again, you may not have that contract with that carrier that is the lowest by 30 cents. So again, that's why I do recommend mapping the carriers that you do business with, so it's a good reflection on the carriers that you represent. So with this, it's going to generate, again, the larger, the national maps. They will take a little bit longer, but you can see it's generating. Areas of gray is where they don't have rates yet. So this is also a case where a lot of agents will ask me, what states does this carrier have product in? And I say, well, just run a heat map really quick. You can quickly run a heat map to see which states they have products in too, instead of wasting your time running quotes in random states. So that is one kind of tidbit or example. So a lot of agents will use this map, one, to save them a lot of time. A lot of agents are licensed in multiple states. Maybe you are an agent that is contracted with several different carriers and you want to quickly glance, okay, I have my ACE map, I have my Allstate map, I have my Aflac map, and I have my Medico map. That way, when I am on the phone with somebody, I can quickly glance at the map and say, oh yeah, I know that Allstate's the most competitive here. I know Medico's the most competitive here. So I've gone into FMO's marketing offices and I see maps all over these different people's desks. And that's incredible because, again, you can quickly glance at something and understand where they're competitive at. So this map is ACE. You can see that ACE is the most competitive nationwide, all carriers in the market in the states that are green. So Kansas, parts of Illinois, Iowa, Ohio, North Carolina. I saw a lot of agents in Georgia. So as you hover over a 3-digit zip code, you can see the premium difference away from the lowest rate. So this is saying ACE is the most competitive carrier by $1.07. So I did a 65. So I know that in this zip code in Illinois, there are 241 individuals that are turning 65 in this zip code. This would be a great area to market ACE to, okay? I work with a lot of agents that are all about the carrier incentive programs, the carrier trips, the bonus programs. How can I just write one more app to qualify? How can I write 5 more apps? We'll use this to figure out where that carrier is competitive at, market that carrier, buy leads in that particular state using Integrity's lead center, and pitch this carrier to these individuals. Make sure you're licensed in that state before you start doing that. But again, this is a great way to see where they're competitive at. Now I can help hover over those areas of yellow, where again, yellow, they're within $5 of being the lowest rate. But you can see in some cases, here in Tennessee, they're only off by 28 cents, okay? So this is where you may want to go in and adjust. Here in Texas, they're off by 21 cents. So in order to figure out what those rates are, who the other carriers are in this area that are the most competitive, that's where you would use the MedSup quoting tool to run your particular quotes, okay? Again, if you want to see that little map parameters, again, you can see that here too. So all you have to do is hover over that little area to see what their premium difference is away from the lowest rate. What's great about this, you can come in here and you can export it. So again, if you want your maps in the different states, you can do that, okay? Let's run another example. I'm going to come up here, I'm going to hit new. I'm going to look at another couple of carriers here just to kind of show you different ways in which you can utilize this. So my state, I'm going to change my state to all. Again, I'm going to keep it 3-digit. My effective date, I'm going to move it forward to 6/1. Oops, 6/1. My plan type, I'm going to look at a G again, but I'm going to change my age to a 69-year-old. Okay, female, keep it a female. I'm going to include household discounts, include the demographics, and then once it recognizes what I want to do here, I can start loading in the primary company. So we're going to use Medico as an example, okay? So we can type in Medico, and you can figure out if that particular carrier has different rating classes too. This is why I'm using Medico to show you the example. You can just select that particular rating class. If you just want to look at their preferred rates or their standard rates, you can do that. If you just want to pull the lowest, you can just do select all and it will bring in everybody. And then you say, well, I want to compare Medico to Aetna. You can type in Aetna and hit select all. Maybe you want to compare Medico to Mutual of Omaha. You can type in Mutual of Omaha. Keep in mind, you will want to make sure that you find all the different subsidiaries. So for example, Mutual of Omaha is also United World, Omaha Insurance Company, Omaha Supplemental, United of Omaha. So I do want to make sure I find all their subsidiaries just so I can properly map them. And then maybe I want to compare them to Cigna too. So now I'm comparing Medico to 3 of kind of more of the top brand names, the Aetna, the Cigna, the Mutual of Omaha, okay? And then I'm going to keep my values at 5 to 10, and then I'm going to hit generate. So this is where you can get really specific to the companies that you represent. So I'm comparing Medico, 69-year-old Plan G female, non-tobacco, applying that against Aetna, Mutual, and Cigna. So you're going to get a different map. This is going to be a different colorful heat map for us to take a look at. We can also look to, again, I kind of mentioned some carriers are competitive in certain pockets of states and not the entire state. So this is why I want to show you Medico here too, and why I recommend when you are running your maps to keep it at a zip 3 or a zip 5. And then after we're done with this map, we're going to get right into the enrollment data for the last 15 minutes here. I know we're coming up close on time, but this is what a lot of agents wanted us to focus in on here. So spending some time showing you the different maps. I think it's easy just to see somebody running the maps for yourself too. So this is interesting. You can already kind of see in the background, we have red and we have green. Again, just every carrier has different pricing strategies. This is Medico's, where they're really competitive in the well-populated, dense areas, suburban areas versus rural areas. So you can see that here as soon as this map is generating. You can save your searches. So if you want to click over here on the left-hand side and save your search, that way you can easily go and rerun maps. You can do that. Again, you can always export these into a graphic or use your computer snipping tool just to take a screenshot of that particular map. So this is Medico's map. Again, we're looking at a female age 69. Again, you can see how competitive they are versus the Aetna, the Mutual, and the Cignas. As you hover over, you can see how competitive they are. And you can see how they're competitive at in the like based upon population. So I had some agents in Texas. You Texas agents, you know that the Dallas, Fort Worth, Austin, Houston, those are your well-populated areas. That's where they're most competitive at. If you hover over to more of the rural areas, they're not competitive. You can see they're not competitive by $30. So again, this is where companies may be different. So even when you're using the CSG MedSup quoting tool to run your quotes, don't just keep in mind, it's not just one zip code, right? They could be, you could run a zip code and it's not reflective of the entire state on where they're competitive at. So keep that in mind as well. So that's just another way that you can run these particular maps. Let's hop over to the enrollment data. We're going to cover this here in 10 minutes. One thing I want to note, if you have to hop off early, there is just a 3-question survey, how you thought today's webinar went, an option for you to provide feedback on the quoting tool or webinars in general, different topics. So if you want to answer those survey questions, I appreciate it. If you do hop off, if you exit out, it should automatically pop up for you. Okay, we're going to go through the Medicare Advantage enrollment data first. So if you click on Medicare Advantage V2, and then click Run Quote. Now, I know a lot of you are using Medicare Center to do your Medicare Advantage quotes, which is fine. Feel free to continue doing that. But our tool will also break out for you enrollment data. So if you want to know how many people are enrolled within certain Medicare Advantage plans, you can use our tool to do that. You can also use our tool to do your hospital indemnity cross-sell with your Medicare Advantage. We have a tool called Fill the Gaps. I'm not covering that today, but I just wanted to point that out. That's why a lot of agents will use Medicare Center for their Medicare Advantage quote and enrollments, but they'll also use CSG for their enrollment data and the hospital indemnity cross-sell. If you want more information on that, just shoot me a message. Happy to provide you information. I'm going to put in a zip code. I'm going to do Dallas. Keep in mind, if you want to do yours as I'm showing you this, feel free to open up your tool. Enter in your zip code, and then you can change your plan type. So if you want to see enrollment data on Medicare Advantage plans or prescription drug plans or your SNP plans, you can select a certain plan type. And then we don't have to enter in prescription drugs to see enrollment data, so you can just put no for the drug costs. If you wanted to do a quote on here, enter in prescription drugs and pharmacies and save that, you can absolutely do that on our system. And then again, one thing to note with our system, and I have to stress this, is that we quote 100% of the market. We are not validating or ready to sell information for Medicare Advantage to be able to quote. So you can quote 100% of the market on here, 100% of the market on MedSup. So to view enrollment data, you would click on this Show Plan Highlights. And you can expand all if you want to see all of them at one time. It does take some time to expand for all of them, so I'm not going to do that here. But when you click on Show Plan Highlights, it will give you some basic plan information here, deductibles, co-pays, drug tier costs. But down here, it's going to start loading in my enrollment data. So now I know for Dallas County, so I ran a Dallas zip code, it brings in Dallas County. I know every month, so we track the last 3 months. I know how many people in this county are Medicare eligible. So a little bit different than the heat mapping tool where we saw on the map how we saw population turning 65, population over age 65 in MedSup versus Medicare Advantage enrollments. This actually pulls in the Medicare eligible. So out of the people that are eligible for a Medicare Advantage plan or they're Medicare eligible, how many people are enrolled in a Medicare Advantage plan? So different than the map. Again, different information and different tools. So I know in this county, the penetration for Medicare Advantage is 52%. Out of that, I can now see how many people are enrolled in this county for a WellCare plan. So 555 people are enrolled in a WellCare plan in this particular county. 292 individuals are enrolled within this particular WellCare no premium open PPO plan. Okay, so I know exactly how many people are enrolled for each carrier and also each plan. So really easy to compare companies here. All you have to do is click on the Show Plan Highlights, scroll down, and now we can see the difference between WellCare and Aetna. Big difference in this particular county, way more enrollments, okay? We can also see that you will see some like Aetna Medicare, this particular plan taking in all the parent enrollment numbers, just because there's also, I think this Eagle plan is set up differently under, one is a just different HMO versus the PPO plan. So again, you can kind of compare Aetna's different plans as their parent, their Medicare Eagle plan is different. So you can see again, the Medicare eligible numbers will stay the same for the county, and then we can then drill it down to parent and plan enrollment. Some of them structure them under different parent company names. So that's why we see 2 Aetna plans. One parent company is different than the other. It's just how those systems are identified for CMS. But again, we can compare that to the Blue Cross Blue Shield. So this is really strong, and this is where I tell people what's really cool is, and we don't show it back, but if you need some data and some reporting from us, we can. My favorite time is coming in here in February and seeing the December to January difference, and we can track how many people switch plans during AEP, because you see the December to January, so you can really track, did that company lose plan enrollments during AEP? Did they gain? That's really interesting to track and see that enrollment data. If you are ever interested in breaking down all the data, we can provide some reporting to you if that's something that you're interested in purchasing from us. We do have that available. You can contact us for more information if you'd like all this out in an Excel file. It would be something that you would have to purchase, but a lot of agents do because it's really valuable information to be able to see everything broken down. But that's how you can track all of the enrollment data for each carrier, each county. Again, you're using the Medicare Advantage version 2, running your zip code, and then clicking on the show plan highlights. So that's how you run Medicare Advantage enrollment data. To run Medicare Supplement enrollment data, we can click on Medicare Supplements and then just enter in your zip code here. So I'm going to enter in my local zip code here in Omaha, and then hit Get Quote. Now, if you are new to CSG, you've never ran a MedSup quote, again, very easy. All you have to do is enter in a zip code, age, gender, tobacco status, plan type, effective date. If you want to apply household discounts, again, we're quoting you 100% of the market. So when you're reviewing the different companies and their premiums, over here on the left-hand side, you would click on Market Analytics. So over here on the left-hand side, click on Market Analytics. And then this is where on the market data on the far right-hand side, this is where we will tell you for that particular 2022, how many people are covered nationally and at this state level, their premiums earned, their loss ratios, and their percent of the market share. So what's different on the MedSup side is that companies only have to report this information once a year. So this is all of the 2022 data. Again, they only have to report it once a year to the NAIC, the National Association of Insurance Commissioners. So it's not up to date every single month like the Medicare Advantages. A lot of the MedSup companies will report monthly. A lot of the bigger companies will report monthly or quarterly. So that case, we do post that in our news section. I'll show you where that is. Like United Healthcare posts quarterly. Most of the time, Aetna will post quarterly to all of their enrollment history. So you can always subscribe to our newsletter if you want that broken out. But this in the quoting tool is going to show you what they reported for that year and what they will require to report. Some companies don't have data in here. If they're a newer company, maybe they only had to report a certain portion of 2022. Maybe their plans were effective in November. So there was only like 2 months worth of data to report. But this is great information to have, especially access into the loss ratios. The loss ratios are huge. So a lot of the market data too, again, I mentioned we break that out in our news section. So if you go to our website, csgactuarial.com, underneath our Learning Center, we have this news tab. You can subscribe to our weekly newsletter. So we send newsletters every Friday, and a lot of those will be talking about different trends in the industry. We posted one out on the Medicare supplement earned premiums. Here's like Cigna's full year in review. eHealth, if anyone's familiar with the website eHealth, they've reported their enrollments. MedSup market carriers, CNO, they reported their Q1 sales for the first quarter. So you can see how their sales are. So that incorporates Bankers Life, Washington National, Colonial Penn. So some of these larger companies will report quarterly, and we will show that in the system. CVS, Medicare enrollment history, so CVS being Aetna, they reported, we have their first quarter results here. So this is something that we do track. If you want to check out our news section or subscribe to them, that way you get the MedSup information more than just that 2022 data. I recommend taking a look out here too for any of that information that we have. So. All right, well, we're at our time limit today. I appreciate everybody's time here today. I know the time that you spend with me is always valuable, so I appreciate you joining me here today. If you are new to CSG, you liked what you saw today, you want to see more, you want to know more about quotes, again, if you go to our website, underneath the Learning Center, we do have CSG app Medicare Center. When you click on that, you can watch all of our previous trainings. I am going to be posting this webinar out to this previous training links, but you will also still receive a copy. And then this is where we have different videos that break out. So if you want a quick intro to CSG, you can watch this one. We have our MedSup quoting and cross-selling, so you can stack MedSup plans next to dental plans. Medicare Advantage, hospital indemnity. If you want to quote hospital indemnity and Medicare Advantage side by side for that cross sell, we have videos on how to submit e-apps, our e-scope. I do have a shorter tutorial video on what we covered today on MarketEdge, so you can always rewatch that too. So lots of great information here. Lindsay, we did record this, so you will receive a copy of today's training in probably about 5 hours, 5 to 6 hours. The system automatically emails it out, but I'm also going to post it here underneath watch previous trainings. Again, this is where if you want to see one of our new to CSG trainings, if you are completely new to CSG, we have a training out there. We have the 5 things to know about CSG. We have some product training with carriers on heat maps and e-apps. We have a great cross-selling webinar with Galen Hendricks, the queen of the bundle. I love Galen so much. If you want to know how to cross-sell, you listen to Galen Hendricks. She's incredible. But all of our trainings are always hosted out here for you, so you can always rewatch it when you have time. All right, thank you, everybody. I'm going to stay on just to answer a couple more questions, but feel free to hop off and please answer my survey questions. I would greatly appreciate that. Patrick, you want to know, is there a way to compare multiple plans side by side? There is. So when you run your quote, I'm just going to use the MedSup quote for an example. Over here on the right-hand side, you have a check mark. When you click on that check mark, it puts this plan into your compare quotes box on the left-hand side. So you can compare up to 5 plans side by side just by hitting that compare quotes box. And then you can click on compare quotes and you can see those 3 plans side by side. Our new to CSG training covers this way more in depth, but there is an option for that. Nikki, you asked about just where we obtain this information. A lot of our data is obtained through CMS and then public files. So a lot of like census information as well, but a lot of the data is provided to us through some public use files that are out there. CMS has a lot of great information. Because we were an actuarial consulting firm, we do have a lot of access to a lot of data that especially helps carriers price out these plans. All right, those were all the follow-up questions that I had that from agents that are left here. So again, have a great rest of your day. I hope to see you on some additional trainings. Let me know if you have any questions. Always happy to help. Have a great rest of your day and a great rest of your week.